Hey, Common Sense Doctor here, and today is simply a revisit of why I'm the Common Sense Doctor. So, early on in my career, I realized that there's not a lot of common sense in medicine. There's Dr. Google, where everybody dies on page 3, so don't read page 3. They're just mindsets that everything is a catastrophe, and it's kind of a joke, but not to those who've experienced it, but not every headache is a brain tumor. And, not every little illness is something catastrophic that's going to take you out. And unfortunately, marketing, media, and fear-mongering have kind of elevated all that. And then there's Dateline and different shows on TV. People always go, "You watch that?" And I go, "No, I don't," okay? Terrible things do happen, and there are some terrible problems out there. But today, I just want to remind you, common sense rules. Common things are common, and that is what most of medicine is. And the body is an amazing organism that can heal itself when given the right tools. And so, with common illnesses, they run their course 7 to 21 days, and there's a typical pattern for it. So when things are outside the pattern, or there's just something a little off, well, we look further. But 90+% of things are common, okay? And you will recover. So, as a result of my travels, I wrote this book, Common Sense Pediatrics. And it's combining alternative and traditional medicine in everyday practice. It is available on Amazon, and it's available in our office, and it's available as an ebook. And it's meant to be a resource. Now, what I love about this book, okay, is that the first half are well visits, covering not everything, or it'd be so thick you couldn't lift it, but covering important aspects of all development from newborn to age 30. And then the second half is how to treat common everyday illnesses with traditional and mostly non-traditional methods. I've covered asthma, I've covered eczema, colic, constipation, diarrhea, vomiting, warts, scars, post-herpetic neuralgia, shingles, RSV, influenza, insect bites, measles, migraines. It's just a lot of stuff that I've covered. This book is a wonderful resource for people, and I actually have patients that they say, "Oh, I called because I did everything you told me in the book and it's still happening," or, "I need additional help." And I'm like, yay. So I hope to inspire people to get back to roots, because common things are common. In med school, they teach us, when you hear hoofbeats, think horses, not zebras. Not every illness is a zebra, all right? Meaning uncommon and possibly awful. So this is why I'm the Common Sense Doctor. And I help people, and our practice and providers help people work through things to what makes the most sense, okay? And remember, the body is amazing. Your children's bodies are amazing, and the body can heal itself. And, lots of times we call it benign neglect. Just stay the course, drink your fluids, do these simple things, and you'll get through it. And it's true, right? Other times we need a little intervention. Sometimes we need antibiotics. Most of the time we don't. We can use homeopathy, Chinese medicine, herbaceuticals, essential oils, tincture of thyme. There are lots of ways to achieve it. And the less we interfere and the more we support the body with natural solutions, the healthier the immune system gets, and the more it can fight off the next thing and the next thing and the next thing. Anyway, this is the Common Sense Doctor signing off, and I will see you next time. Have a great day.